When treating the lips, it's important to decide early on whether you are enhancing the lip edge or you are volumizing. Sometimes it can be one or the other, and in Gemma's case, we're going to do a little bit of both. When we look at Gemma's lips, we can see that her upper lip is noticeably smaller than her bottom lip. Now, upper lip should be smaller than the bottom lip, but to a certain degree. So ideally, we want the upper lip to be about 2/3 the size or the diameter as the lower lip. And here, we've probably got a ratio where the upper lip is only half the size. So we want to improve the volume in the top lip, but we also want to add some definition and shape, because when we look at Gemma's face from the side, we can see that the lip edge on the lower protrudes more than the lip edge on the upper. So for lip balancing, for lip contour and shape, we're going to add some filler in the edge of the lip, and then we're going to place some dermal filler in the body of the upper lip to give that extra volume and improve the ratio. On the lips, we're going to inject filler along the vermilion border, so we won't mark that out. I'll explain that as I'm injecting it. However, what I am going to do is augment the tubercles of the lip, and the way I'm going to do that is in 2 points 1 centimeter apart in the body of the lip. So if you imagine this half of the lip, 2 points evenly spaced 1/3 and 1/3 all the way along, that's where the tubercles are, that's where we're going to inject the dermal filler. Same on both sides. If you're going to do it on the lower, then you can do the same on the lower, but usually I just place one injection halfway along the lower half of the lip. Okay, so when we're injecting the lips, we're going to use mildly define because I want something that's going to give a little bit of volume and definition rather than just definition itself. We're going to use a needle, and when I inject the top lip, especially on the border, what I like to do is I actually inject from the outer corner up towards the Cupid's bow. So I start here and work towards the middle. This is because the filler has local anaesthetic in, so by injecting some filler into the lip here, that local anaesthetic will help anaesthetise the further injections round towards the Cupid's bow should I need them. If we place these injections here very, very well, we might be able to get the filler up to the Cupid's bow without having to inject, and I'll demonstrate that now. So using your non-injection hand, just get some tension on the tissue, just your thumb and your index finger pushing away from each other, stretching the tissue from the corner along the vermilion border and just in 1 centimeter, quite superficially, not deep. You can see the needle there, I'm lifting up. Now what I'm going to do, just open your mouth for me a little bit. I'm just going to, with my thumb and forefinger, I'm just going to lift up the lip, get some traction and support and squeeze it together. And then what I'm going to do is slowly start to inject the filler, and as you can see the filler now is traveling along that vermilion border up towards the center of the lip. I've injected 0.1 of a cc and I'm going to withdraw. Now I'm going to just massage that filler up, and as you can see quite clearly, I've managed to get the filler almost all the way to the Cupid's bow without having to inject up there straight away. We'll leave it now a minute or two for the anaesthetic in the filler to work in that area, so that when I want to place my second injection 1 centimeter up, I'm injecting into a partially anaesthetised area, which will improve the comfort for the patient. So when it comes to placing our second injection, we've made our first one here, move 1 centimeter along, again stretch the tissue and into the lip. And how was that? Was that less painful then?
Yeah.
Much more comfortable. Again, lift up, we're not in the deep part of the vermilion border. I like to pinch the tissue again, not pinching it with the tip of my finger, but the flats of my fingers, just so that I can help guide that filler along into, as you can see, I'm injecting now into the Cupid's bow. I've injected just under 0.1 and I'm withdrawing. And what that's allowing me to do is it's allowing me to inject filler into the lip with less injections, it's less traumatic, and the filler is finding its way to the center of the lip rather than me forcing it into a place where it can go. So therefore it's less traumatic for the patient and will give a more natural result. And as you can see, with 2 injections, we've managed to get the filler all the way through up to the Cupid's bow with only 2 injections and minimal pain. So now we're going to inject the tubercle. So the way I like to do that is approach from outside of the lip. So I'm going to inject through the skin. I'm injecting at 45 degrees towards, so I want the bevel of my needle underneath where the white mark is. So 2 millimeters outside of the lip, 45 degrees and into the body of the lip. And you can see that my bevel now is just under that white marker. And then I'm just slowly going to inject. And as you can see, we're now volumizing the lip, and I'm not pulling the needle out. I'm just leaving the needle in the body of the lip. So 0.1 cc and out. And then just some gentle massage. And I'm going to repeat the process in this tubercle here. So exactly the same process, 2 millimeters outside, 45 degrees underneath the marker, and you can see the filler flowing into the body of the lip in the corners. And then always afterwards, just some gentle, not too hard massage, just to manipulate the filler and make sure it's smoothed down. If you look at the top lip now on the right side, you can see we've got really good volumization on the lip, but it just falls away over the Cupid's bow. So just before the crest of the Cupid's bow, I'm going to inject along, and I'm just going to place a little bit of filler, again tiny amount, and that now is 0.5 cc into that side of the lip. We're going to move on to the lower lip. She's got a very good natural lower lip, so I don't want to make any real changes. All I'm going to do is going to place some filler along the vermilion border in this section just to enhance the definition, and possibly some in the tubercle about there. So a similar approach from the outer working to the midline. We're going to inject underneath the vermilion border, lift up, squeeze with the flats of our thumb and index finger, and we're just going to advance some filler along that lower border, 0.1 cc. And then we're going to inject the tubercle. We can see the tubercle here. So outside of the lip on the skin, 45 degrees into the body of the lip, and a small bolus just to give a bit of definition there. And again, final bit of massage. So we've treated the right hand side. You can see we've enhanced the border, shaped the upper lip, we've increased the volume. This lip now is about 2/3 of the depth of the lower lip. So, or effectively the lower lip is about 1.5 times the depth of the upper lip. So the proportions are right and it's more balanced, but we've also improved the volume and the shape of the lower lip on the side, and that just improves the shape overall and gives a nicer contour to the lip. I can also see the lip from the side, and we've got great balance with the upper and lower lip. So the lower lip now is not protruding overly compared to the upper lip. Again, stretch the lip tissue onto the upper, outer, working towards the center, underneath the vermilion border, picking it up, picking your needle up, thumb and forefinger just supporting the tissue and injecting. And if you might be able to just see that, you might be able to see from that angle the filler is just flowing along to the midline. 0.1 cc injected in. And then we'll wait for a minute or so just for the anaesthetic to take hold. While I'm doing that, I'm going to inject the lower lip. So again, outer, going towards the midline, under the vermilion border. I'm not advancing the needle, thumb and forefinger, and then just flowing the filler along towards the midline, 0.1 cc again, just to create a bit more definition on the outer lip. I'll inject the tubercle on the lower lip, So 45 degrees through the skin just outside the vermilion border into where the tubercle mark is. It's rubbed off a little bit now, and just 0.1 cc into that lower lip tubercle there. And then when we're ready to advance and continue work on the top lip, 1 centimetre along, this area should be partly anaesthetised from the filler underneath. Little scratch, advance the needle along the lip edge, little scratch, advance the needle along the lip edge, again just guiding the filler, and it's flowing over into the cupid's bow, and I can feel it and see it running along. I'm just going to top that a bit up, guys, alright, because I couldn't see it because my hand's in the way. Now we're going to do the tubercles. So again, 45 degrees through outside the vermilion border through the skin, needles underneath where the lip tubercle is, and a slow injection of 0.1 cc, giving that volume in the centre of the lip. Same on the outer tubercle, 45 degrees. Close your lip for me, darling. Now I'm just massaging that filler in just along the vermilion border, making sure there's no obvious bumps, no obvious areas of thickening. They look great. And then I'm just finishing off just behind the crest of the cupid's bow, into the cupid's bow, just to give a lift. And now just final tweaks just to improve symmetry. And that's done. So I completed the lip treatment. I'm absolutely delighted. Apart from a small amount of swelling, so there's probably about 20%, they'll come down by about 20% from this. But apart from the swelling, you can really see here now the increased volume in the top lip. That's given us a much better facial balance. The lower lip is now not too big in relation to the top lip. We've got the right proportions, the right ratios, and the combination of using the dermal filler in the vermilion border and in the lip tubercles has both improved the contour or the definition of the lip and the overall shape. So I'll be delighted to see how that looks in a couple of weeks when the swelling's gone. Just as a note for the fillers that we've used, we used Miley Define exclusively in the lip here, and we used it both in the vermilion border and in the lip body and the tubercle injections. We placed 0.5 cc in total on the upper right side of the lip and 0.5 cc on the upper left side of the lip, and then on the lower lip we used a total of about 0.3 cc here and 0.3 cc on the lower left side, so a total of 1.6 cc in the lips. Sounds a lot, but that will go down, and it's given us a great result.